Hello and welcome to today's interview with Silas Goldman, Senior Director of Operations. I'm Audrey Cushing, Business Services and Quality Director at AVP Technologies. Are you interested in population health management? That's exactly what we are going to be discussing today. Silas, thank you for joining us today.
Yeah, thank you, Audrey. I appreciate you having me.
So what's happening in the healthcare industry that's inspired you to write this paper?
Well, if there's anything that we could agree on is the effects of the pandemic kind of propelled population health to the forefront of everyone's dialogue. A lot of the conversations around the evolution of social determinants of health and how to understand what makes a population vulnerable, and then how to react to that vulnerability and plug those gaps. So I thought it would be advantageous to write a paper on my lessons learned from the field, the do's and don'ts of what I've learned from population health management.
Yeah, and lessons learned are always so important. So what are some of the key points that you would want your reader to take away?
I think the whole concept of this paper is focusing on the new, what it looks like with a digitally enabled model supplemented with human capital, and then how to create a synergy between those two concepts. Machine learning has really changed the way that we conceptualize population health. We're still looking at claims data, and I think that serves as the backbone for any population health management program, but you have to augment that type of service with human capital, the expertise to know what the data doesn't tell us.
Makes sense. Are there action steps that you would want the audience to take after reading the paper?
Absolutely. And that's a good point. Early identification of that at-risk population is key to any population health strategy. Understanding what disease sets are prevalent within your geographic region, and then possibly look at the social determinants, the access of care, dual enrollment status. Look at stratifying the risk across your member beneficiaries and understand if there's an area that you could plug in more specialists to try and prevent these ailments before they become long-term chronic diseases.
Makes sense. All right, well, that's our time for today. Silas, thank you again for joining us. And for our audience today, please visit the AVP Technologies website and download a copy of Silas's paper. Thank you.